This PowerPoint contains few question and answer for NCLEX licensing exam, and I strongly believe if you practice, it helps you to get your license. You see one of the picture here, one of my favorite person gave me this picture, and it is really so wonderful. Look, you see, the life is the most persistent and urgent question is, what are you doing for others? Yes, it is true for everybody. We have to ask it ourselves, but we are doctor or healthcare provider, so we always keep it in mind when we serve for the people. Now we are going to preparing for our licensing exam. Here is something is important for us. Faith is lacking the first steps when and even when you do not see the whole case or story. So I said everyone has who has ever passed the exam know how much stress the day can get. So to pass it successfully, a person should study so hard, but still it is not the key element to success. So the moral support or play a vital role as well. So which is the way more important as it is the faith in oneself that makes everything possible. So faith is taking the first steps to success. And also I said, during this journey, it is important to keep it in mind. What are you doing for others? Let me start the question and answer. The first one, a nurse is obtaining a history from a new client in the cardiovascular clinic. When investigating the childhood disease and disorder associated with the structural heart disease. So when we talk about the uh, any childhood heart disease or structural heart disease, definitely we have to talk about the congenital heart disease. So here, which findings should the nurse consider the significant, right? So congenital heart disease is a structural heart disease. Congenital heart disease is most common, the birth defect. So heart disease is difficult enough when it is uh, find out in adult, but it can be especially triggered when found in the children. There are many different type of structural heart disease or congenital heart disease that can affect the children, such as arrhythmia, pericarditis, cyanotic heart disease, Kawasaki disease, or congenital heart problem. Here showing the which findings should the nurse consider the significant, they said, right? First of all, here the probes, and then rheumatic fever, severe staphylococcus infection, or medullary spongy kidney. The correct answer is rheumatic fever. But here, what is Crohn's? So it is Crohn's actually an infection of the upper airway that blocks the breathing and causes the very bad cough. Sometimes it is also known as bronchitis. The rheumatic fever, which is the answer basically, it is a complication of staphylococcus infection or staphylo throat infection or scarlet fever that can cause a wide range of secondary symptoms from joint inflammation to the heart valves damage. Let me recap it. When any infection causes the inflame our throat, the infection from the throat they spread to the heart, particularly heart valve, and causes the inflammation of the heart valve and damage. It is called rheumatic fever. So another here's medullary sponge's kidney. You see, this is the normal kidney, and this one is a medullary sponge kidney. So medullary sponge kidney is usually a benign condition, and patient can remain asymptomatic for a long time. Despite being a congenital disorder, medullary sponge kidney usually is not diagnosed until the second or third decade of life or later. So it is also structural defect, or it is also the disease most common in the children. Now, if before to go rational, I want to tell one more point. What are the common symptoms of heart disease in the children? Usually patient present with shortness of breath or difficulty of breathing or getting out of breath with activity sooner than the other children. Also getting sweaty or chest pain, irregular heartbeat, right? Restaurants say the childhood disease and disorder associated with structural heart disease include rheumatic fever and severe staphylococcal infection. Crops is a severe upper airway inflammation and obstruction that typically strike the children aged 3 months to 3 years. May causes latent complications such as ear infection or pneumonia. However, it does not affect the heart structure, and likewise medullary sponge kidney or characterized by dilation of the renal parenchyma and formation of cavity. Also, the cleft or cyst in the renal medulla, or may eventually lead to the hypertension but does not damage the heart structure. Next question here. Which condition is most commonly result in the coronary artery disease? Coronary artery disease is shortly called CAD. Atherosclerosis, diabetes mellitus, myocardial infarction, or renal failure. The correct answer is atherosclerosis. Restaurant said atherosclerosis is the leading cause of coronary artery disease, and coronary artery disease can cause myocardial infarction, and myocardial infarction can lead to the heart failure, right? But it is preventable if you modification your lifestyle or if you modification your food habit. So diabetic mellitus is a risk factor for coronary artery disease, but it is not the most common cause. Myocardial infarction is a common result of CAD. Renal failure does not cause the coronary artery disease, but the two conditions are related. What next? So question here, a nurse is performing discharge teaching with a client who has a implantable cardioverted defibrillator, and which client statement indicate effective teaching? A, I will keep a log of each time my ICD discharge. I cannot wait to get back to my football league, and I have an appointment for magnetic resonance imaging, shortly called MRI, for my knee scheduled for next week. And four, I need to stay at least 10 inches away from microwave. So question keyword is implantable cardioverted defibrillator. What it is? Actually, it is a device, right? An implantable cardioverted defibrillator, shortly called ICD. It is a small battery-powered device placed in the chest to detect and stop abnormal heartbeat. It is called arrhythmias. So if anybody have a dysarrhythmia and it is very bad, we need ICD. And ICD is continuously monitor the heartbeat and deliver electric shock when needed, right? And when needed to restore a normal heartbeat. Now question about ICD, which is the correct? The correct answer is, I will keep a log of each time my ICD discharge. Rationale. The client starting that he should keep a log of all ICD discharge also indicate effective teaching, and this log helps the client and physician identify the activities that may cause the arrhythmias and that makes the ICD discharge. And he should also record events right before the discharge. The client with ICD should avoid contact sports such as football. They must also avoid MRI or magnetic field, which could permanently damage the ICD. Household appliances do not interfere with ICD. What next? Next question here. A client with a severe angina pectoris and electrocardiogram change is seen by a physician in the emergency department. In terms of serum testing, it is the most important for physician to order cardiac. 1. Creatinine kinase, B. Lactate dehydrogenase, 3. Myoglobin, and 4. Troponin. Angina pectoris, right? Also known as intense coronary disorder or angina pectoris. So it is the chest discomfort or shortness of breath causes when heart muscle receive insufficient oxygen-rich blood. Angina pectoris, if not treated, it leads to the unstable angina. Unstable angina, if not treated, it leads myocardial infarction, and myocardial infection can cause heart failure, and heart failure, if not treated, lead to the death. So this say for physician order cardiac creatinine, so which is the correct answer? This is the troponin, right? So here I want to tell you the common sign and symptom of angina are like chest pain or pain that is radiate to the left jaw, arm, neck, throat. Also, patient feel the sick, exhausted, shortness of breath, dizziness, light headache, weakness, and restlessness. So if anybody have it, it is important to diagnose the disease. How we diagnose this? So diagnosis provide, healthcare provider may recommend one or more diagnostic tests and procedure as part of evaluation. Diagnosis basically involve the laboratory test to confirm the diagnosis. Beside of electrocardiogram, we test the troponin test, which is number 4, troponin. Troponin, a blood test to check if there is a heart attack or chest pain, is worsening, usually done to identify unstable angina, right? And here they said creatinine. Creatinine is the kidney function test, right? And here rationale. This client exhibits sign of MI, myocardial infarction. The most accurate serum determined of MI is the troponin level. Creatinine kinase, lactate dehydrogenase, or myoglobin test can show evidence of muscle injury, but they less specific indicator of myocardial damage than troponin. What next? The most important reason for a nurse to encourage a client with peripheral vascular disease to initiate a weakening program is that this form of exercise. So number 1, reduce the stress. 2, aids in weight reduction. Number 3, increasing high density lipoprotein level. And number 4, decrease the venous congestion. Your patient have a peripheral vascular disease. This is the keyword, right? So if patient have a peripheral vascular disease, means patient peripheral vascular disease, also called peripheral arterial disease or PAD. So PAD is narrowing of the artery, which is result in reduction the blood flow to the upper or lower extremity, or reduce the head, arms, stomach or legs, and usually affect the artery in the legs, and this causes the leg pain while walking, right? So if patient have it, how we identify? So first of all, go, what are the answer? Answer is reduce venous congestion. Rationale, regular walking is the best way to reduce venous congestion because using the leg muscle as a pump help return blood to the heart. Regular exercise also aids in the stress reduction and weight reduction and decrease the formation of HDL, which are all beneficial to a client with peripheral vascular disease. However, this change do not have a significant effect on the client condition as decreasing venous congestion. Next question. To correct the landmark for obtaining apical pulse rate, right? So pulse rate, but it is apical pulse rate. So is it left fifth intercostal space and mid axillary line? Left fifth intercostal space, mid-axillary line. Number 3, left second intercostal space, mid-axillary line. Who left seventh intercostal space. So definitely seventh is not answer. Second is not answer. Maybe answer supposed to fifth or fifth. Left fifth intercostal space, mid axillary, mid clavicle. So definitely it is not mid axillary, right? It is not mid axillary, I think. It should be the mid clavicular, right? So a question about the apical pulse. An apical pulse is the number of the heartbeat per minute as measured at a specific location. Usually, doctor uses stethoscope to measure the apical pulse or heart rate. If I ask you where is the apical pulse best heard, apical pulse is found below the nipple on the left center of the chest. Apical pulse is specifically below the fifth intercostal space at the mid-clavicular line, right? So next, go and see what are the answer. So it is number 2, left fifth intercostal space, mid-clavicular line. Rationale: the correct landmark for obtaining an apical pulse is the left fifth intercostal space in the mid-clavicular line, and this area is the point of maximum impulse and location of the left verticular apex. The left second intercostal space in the mid-clavicular line is where the nerves auscultate the pulmonic sound. The apical pulse is obtained at the mid-axillary line, or the seventh intercostal space is the mid-clavicular line. So next and last here, one of the successful person, Jack Ma, he said, never give up. But when you start something new, today is the hard, tomorrow will be yours. But the day after tomorrow will be sunshine, right? So you start your journey to get the license. Just work so hard and keep in trust. Once you will get it. Thank you.